So this table here will help you a lot. If you understand this table, it will help you to know what is the right treatment, the right antibiotics to choose for a skin treatment, the right antibiotics. So what is that telling you? So the first thing to know is is if patient presents like the way I broke it down, if patient presents with a severe condition. What do I mean by severe condition? Conditions that will make you to be worried. You see a patient and immediately you see this patient, you know that no, this is hard. It's not something that you will tell the patient to go home. You will do something right away. It's either you do antibiotics or you do so. Just think about anything that you are thinking about, something that there may be complication. I'm worried about complication. I'm worried that this might be life threatening. I'm worried about this is a very bad skin condition. I'm worried about massa. I'm worried about, under cellulitis, we have both we have both infectious and non-infectious, or purulent and non-purulent. So you are worried that something is not right. You are worried, you can send this person to a specialist or hospital. So any of those skin conditions, think about it. There are so many skin conditions that falls under these categories you are worried about. For example, um when we talked about Rocky Mountain spotted fever, when we talked about that, you know, you are worried that this patient might die from it. We said it. You are worried about organ involvement. When we talked about Lyme disease, you are worried about organ involvement. Okay. So you are worried about something. Okay. In cases like that, your first line of treatment is usually BCD. So any of those high risk life threatening condition that I need to do something, if I don't do something, so that can be high infectious. So I'm just going to put it just for you to know. You can use BCD. It's not that you will not send them to the hospital, but it depends on the case. Like we said, if it is a complication, if it is massa, if it is life threatening, if it's something that oh, something is not right, I'm not going to leave this person like this, think about BCD. So I'm giving example of all these high yield things. For example, somebody that have purulent um purulent cellulitis, somebody that have massa, somebody that have severe cellulitis, any of these, you know severe conditions. It can also be tick. Example of those tick bite we mentioned: Rocky Mountain spotted fever, erythema migrans. So any of these conditions, you are thinking about something is life threatening, is any of them. They may have a rapid progression. They may have a failure of outpatient treatment. They may have a severe pain. Any of those things can be included there. Think of BCD. That is the summary of what I'm saying. Think of BCD: Bactrim, clindamycin, um, doxycycline. Think of BCD. Any of those high life-threatening condition, BCD. So don't go and tell me that you will use Keflex when somebody have massa. Don't go and tell me that you will use Keflex when somebody have a purulent cellulitis. That is wrong. Okay, so you are worried about life threatening, you are worried about rapid progression, like cases of a Rocky Mountain spotted fever. You are worried, like we said, you don't even need to wait for the lab to start the treatment. You are worried about systemic symptoms like Rocky Mountain, Lyme disease. You are worried about systemic symptoms like cellulitis, purulent cellulitis, infectious cellulitis. Cellulitis, you are worried that patient to have fever, patient to have chill. Any of these conditions, always think about BCD, please. Always think about BCD. It very very important. Always think about BCD. It can also be a severe inflammatory complicated conditions. Any of these things we mentioned, okay, like severe mastitis, like severe erysipelas, okay, anything severe, anything severe, think about BCD. I'm making it bold for you to think about that. Think about BCD. BCD. Okay, then we go to the next one. So that is your treatment. If it's something you will send them to the hospital, please send them to the hospital. But the emphasis I'm placing here is when to choose BCD and when to choose KCD. So it doesn't stop the fact that they need to go to ER if they need to go to ER. But if they don't need to go to ER, patient, you did the wound culture and it came out massa, you don't need to send the patient to the hospital except if patient have other symptoms like all those systemic symptoms. But other than that, you know, you don't need to. So those condition is your BCD: Bactrim, clindamycin, doxycycline. Then let's talk about non-infectious one. The ones that is non-infectious, mild condition, anything that is mild, you can tell the patient, okay, you can take these antibiotics, go home, monitor your symptom, you know, those ones are mild symptoms, mild conditions. So example of those ones are non-infectious, non-purulent, mild, moderate to skin conditions. Example, something you can treat outpatient. Example, mastitis. Remember, uncomplicated. Some of all these things we mentioned here is still here, but here it was severe, severe. So don't get my explanation wrong. What I'm saying is mild condition, mild erysipelas, impetigo, you know, impetigo, mastitis, hydantoin suppurative. Those things are mild, okay? And what we usually use in those conditions is usually your cefalexin, dicloxacillin, and clindamycin. That is your KCD. KCD. Okay, KCD. The only time that you will use doxycycline is if patients have MRSA. Doxycycline is always MRSA. So even if it's mild, the patient have mild symptom, but they have MRSA, okay, then you can use doxycycline. So this is the one that we use, KCD. KCD. Any mild symptom, any conditions that is mild, like non-purulent, non-infectious cellulitis, we use KCD. So for emphasis again, I repeat myself. Remember this table anytime you are doing your skin treatment. What is the right choice of antibiotics to choose? Like I said, anytime you are thinking about conditions that are life threatening, conditions that are high healed, high risk, conditions that I may be thinking about referral to ER, referral to specialist, okay? Anytime you are thinking about those kind of situation, when you see a patient, you are thinking about things like that. What do? You are going to give them BCD, Bactrim, clindamycin,
And
doxycycline. That is the thing. But anytime there is a mild skin condition, you are not worried about massa, you are not worried about sending them to hospital, you are not worried about something. You just say, okay, take these antibiotics, come back if your symptom just, you just know that, and just tell them, okay, escalate it if there is fever or if there is, so anytime there is a mild one, then you will use your KCD, Keflex, clindamycin, doxycycline. So that is very important. And one more thing I want to emphasize, because somebody will say the treatment for cellulitis is massa, is a Keflex. Is true and not true, because in Keflex, in cellulitis, we have purulent and non-purulent. So I'm going to emphasize on that one too, because it's very important. There are clues. So you have to check, is it, is there pus, any history of massa. So anytime you are thinking about those things, it would let you know if you are going to treat it as just KCD or BCD. So, but like I've always said, anything about cellulitis, think of massa, especially when it is purulent, when it is infectious. So you see something like this. I'm giving you example. Something like this. Something like this. You will not come and be giving patient careless. So something like this. Like we say that cellulitis, there is no well demarcated border. So it's deep dermis, deeper part of the dermis. I like to emphasize myself so many times so that if you don't get it once, you get it again. So something like this, of course, you are saying that you are worried about massa. So if I am worried about massa, even without doing wound culture, okay, I am worried about massa, you know, I am worried about it. So something like this, what I will do is BCD. BCD. So it's very important, especially because the reason I'm emphasizing on this is that sometimes once a patient comes in, and because you see it's not you see it's cellulitis, you are just giving the patient, um you are just giving careless, is not really right. So sometimes, okay, let me move the picture. So know when to do, if it's purulent, if it's non-purulent. So okay, if it's non-purulent, I can bring down the picture. But I will also tell you one thing. If there is no pus, if there is no abscess, I'll bring down that picture so that it can be in this slide. If it's non-purulent, sometimes this is non-purulent because it's just red. Okay, this is it looks like a it's so swollen. You can see it looks like somebody that is having fever and all that and all that. It can be abscess. There is drainage. Remember the three things we are looking at. You may say, oh, there is no pus. There may not, purulence means pus. Abscess, then drainage. You can see there is drainage. But if it's just plain like this, you can say, okay, this is non-purulent. Okay, but like I said, it all depends, because sometimes pictures doesn't do the justice very well until you see it in real life. In real life, you can be able to determine. But the summary of what I'm saying, if you think it is just red, warm, swollen skin, and there is no pus, there is no abscess, okay, you can do KCD. But there is a way they ask it in the exam, let me tell you. If a patient comes in, like this patient comes in like this you are seeing, patient comes in with red swollen skin, they can ask you a question, what is the treatment? the option can be careless, okay? But what if patient comes back and complain that they are having worsening swelling? So the swelling now, even though you gave them something before, you gave them careless before, and they came back again complaining it is getting worse, more swelling, more redness, what do you do now? You are going to monitor them for DVT, and you're also going to um, make sure this is not massa. You can change it to doxycycline. But in the summary of everything, know when to do BCD and know what to do KCD. Once you know when to do that, it helps to answer most of your questions.